To lower high blood pressure, also known as hypertension, start by being active and exercising. Obesity and the buildup of fat tissue around the body is one of the leading causes of high blood pressure. When you're overweight or obese, the heart has to work harder to pump blood throughout the body, and it puts strain on your arteries. Walking every day for 20 minutes is a great way to start, to build a good healthy habit and get you headed in the right direction, to improve your cardiovascular levels, burn fat, and help you lose weight. Then you could get into other physical activities and add them into your routine. Number 2, add more fruits and vegetables into your nutrition. Fruits and vegetables have plenty of nutrients that are healthy for your entire body and heart. They have high amounts of potassium that counters and reduces high sodium levels in the body. Eating too much high sodium or salty foods causes high blood pressure because it will cause your body to retain water. The added water puts stress on your heart and blood vessels. Aim to eat 6 to 10 servings of fruits and vegetables per day. Number 3, cut back on high salty, sodium, and fatty foods, usually from processed foods, restaurant foods, and fast foods. They are high in fat too. These foods are high in sodium because sodium helps to preserve these foods to last longer. One meal of fast food can give you double the amount of the recommended daily intake of sodium. That is about 2,300 milligrams for both men and women for the whole day. That equals about 1 teaspoon. On average, most Americans eat about 3,400 milligrams of sodium each day, exceeding the recommended daily amount by 1,100 milligrams. It is recommended to limit sodium intake to 1,000 to 1,500 milligrams if you have high blood pressure. This will help drop systolic blood pressure down by 5 to 6 millimeters of mercury. Learn to prepare your own food because it's lower in sodium and you can choose how much to add. Even if you're in shape and healthy, eating a few processed meals or fast food meals can cause your blood pressure to increase fast. Sodium is an important electrolyte for muscle contraction, but you don't need to eat a lot of it to function. Read food labels and choose low sodium and fat options. If you eat out, ask for nutritional labels and choose meals with low sodium. Don't add additional salt to your meals, and stay away from adding too much sauces and seasoning because they are packed with sodium. Some examples are barbecue sauce, soy sauce, ketchup, and salad dressings. A few tablespoons of these items are high in sodium. Number 4, drink plenty of water. Although sodium causes the body to retain water, and adding more water can potentially increase your blood pressure, but as you begin to become more active, exercising and eating healthy, water will help you sweat out excessive salt and sodium through your pores, reducing high blood pressure. When the sweat runs down your face, taste it. If it burns your eyes and tastes too salty, that's a good indication that you have too much sodium in your body. As you begin to hydrate and drink more water, you will notice that your sweat will become diluted and won't taste so salty. Aim to drink half of your body weight in ounces each day. For example, if you weigh 230 pounds, drink 115 ounces of water daily. Number 5, stop smoking both cigarettes and marijuana, and stop vaping. Inhaling smoke will increase blood pressure by narrowing the blood vessels and arteries, and putting strain on the heart and lungs to pump blood and breathe. Smoking also dehydrates the body. Vaping is the inhaling of a vapor created by an electronic cigarette that has the same effect on your blood vessels and arteries as smoking cigarettes because it contains nicotine. Number 6, stretch. Stretching relaxes the body and opens up the blood vessels, increasing blood flow and circulation throughout the whole body. Through exercise and regular daily activities, knots can develop around the body. When you stretch regularly, these knots get released, allowing for better blood circulation and putting less strain on the heart. Start off by doing one stretch for your lower body, one stretch for your midsection or core, and one stretch for your upper body or arms. Hold the stretch for 20 to 30 seconds and do 2 to 3 sets. Then you can build your way up to more stretches and improve your flexibility. Number 7, deep breathe. Deep breathing relaxes the body and relieves stress and anxiety. Stress can cause the body to produce more hormones that will temporarily increase blood pressure. You'll most likely start to shallow breathe and not allow full oxygen circulation around the body when you're stressed out and feeling anxious, causing the heart to beat faster and your blood vessels to narrow. Practice deep breathing by inhaling for 4 1,000ths of a second and exhaling slowly for 4 1,000ths of a second. Allow the oxygen to drop to the lower part of your stomach or diaphragm, down to the pelvic floor. Do this 10 times and you will feel a release of tension and feel more relaxed. You can practice deep breathing anytime you get stressed out, during stretching, during meditation, while exercising, the first thing in the morning when you wake up, before you go to bed, or all throughout the day. At first it might feel strange, but eventually the muscles in your diaphragm will expand and stretch out the more you practice. Number 8, rest. Resting relaxes and heals the body. When you rest, sleep, and take naps, your blood pressure will decrease because you're not moving, eating, or stressed out. It's a great way for the mind and body to rejuvenate. If you're doing your own blood pressure test, make sure you are relaxed so you don't get spiked readings. A good time to test your blood pressure is in the morning, when you first wake up before any activities and even eating. Blood pressure will continue to rise in the morning and peak at midday. Blood pressure levels will start to slowly drop in the late afternoon and evening, so your second blood pressure reading can be taken in the evening before going to bed. An automatic blood pressure monitor doesn't require a stethoscope and is easy to use. A monitor takes your blood pressure reading using a cuff that fits around the upper arm. Sit in an upright position with straight posture, with your feet on the ground. Don't take readings through clothing and wear a short-sleeved shirt. Do 2 to 3 blood pressure readings at one sitting, so you get accurate results. A good normal blood pressure reading is less than 120 millimeters of mercury over 80. The mmHg stands for millimeters of mercury. An example of a normal blood pressure will be 117 over 77. The higher number or top number is the systolic pressure, the amount of pressure during the contraction phase your heart exerts while breathing and pumps blood out to the body. The lower number or bottom number is the diastolic pressure, the amount of pressure in the blood vessels and arteries between beats when the heart is at rest. There's a greater risk of stroke and heart disease when systolic pressure is higher compared to elevated diastolic pressure. A high diastolic reading equal to or greater than 120 is linked to a higher risk of disease involving the large artery, called the aorta, that carries blood and oxygen from the heart to distant body parts. Normal blood pressure is important for proper blood flow to the body's organs and tissues. Each heartbeat produces blood to the rest of the body. Blood moves from high pressure near the heart to low pressure away from the heart. Blood pressure is determined by the amount of blood pumped by the heart and the diameter of the arteries the blood is moving through. The more blood that is pumped and the narrower the arteries, the higher the pressure is. Blood pressure is measured both as the heart contracts and relaxes. When it comes to the stages of high blood pressure, normal blood pressure is less than a systolic pressure of 120 and a diastolic pressure of 80. Elevated blood pressure is when the systolic pressure is 120 to 129, with the diastolic pressure less than 80. Stage 1 high blood pressure is when the systolic pressure is 130 to 139, with a diastolic pressure of 80 to 89. Stage 2 high blood pressure is when the systolic pressure is 140, with a diastolic pressure of 90. A hypertensive crisis is when the systolic pressure is 180, with a diastolic pressure of 120. Seek medical attention if your blood pressure gets this high. These blood pressure readings are for both men and women ages 13 years and older. If you are 13 years or older and your blood pressure drops below 90/60, it is too low, also called hypotension. If your blood pressure suddenly drops and you feel symptoms of dizziness, seek medical assistance. Blood pressure readings for infants and children from birth to 12 years old will be different from teens and adults. While 47% of adults in the United States have high blood pressure, only 4% of children experience high blood pressure. Normal blood pressure readings for newborns within 12 hours is a systolic blood pressure of 60 to 85, with a diastolic blood pressure of 45 to 55. Neonates within 96 hours is a systolic blood pressure of 67 to 84, with a diastolic blood pressure of 35 to 53. Infants 1 to 12 months is a systolic blood pressure of 80 to 100, with a diastolic blood pressure of 55 to 65. Toddlers ages 1 to 2 years old is a systolic blood pressure of 90 to 105, with a diastolic blood pressure of 55 to 70. Preschoolers ages 3 to 5 years old is a systolic blood pressure of 95 to 107, with a diastolic blood pressure of 60 to 71. School age 9 to 6 year olds is a systolic blood pressure of 95 to 110, with a diastolic blood pressure of 60 to 73. Pre-adolescents ages 10 to 11 years old is a systolic blood pressure of 100 to 119, with a diastolic blood pressure of 65 to 76. Adolescents ages 12 to 15 years old is a systolic blood pressure of 110 to 124, with a diastolic blood pressure of 70 to 79. High blood pressure can damage important organs such as the brain and kidneys, and can lead to a stroke. Signs and symptoms of high blood pressure is rapid or irregular heartbeat, difficulty breathing, fatigue or confusion, severe headache, nosebleed, chest pain, back pain, numbness, weakness, change in vision, difficulty speaking, and blood in urine. Sometimes you don't feel symptoms when you have high blood pressure, so check your blood pressure regularly to make sure it's normal. Check your blood pressure twice per day for 1 week. If readings average in normal ranges, take your blood pressure readings twice per month. If your blood pressure is high and remains high for a week while testing, continue the daily test until your blood pressure readings average is normal. Apply these steps and your blood pressure will drop to healthy levels, and you will get off blood pressure medication.